everyone. This is Barbara Phillips with Nurse Practitioner Business Owner. And I have Don Self with us today to ask him some questions. And Don, why don't you tell us just a bit about yourself?
Okay, thank you, Barbara. I've been a reimbursement revenue consultant for about 38 years, and we help providers all over the country in the areas of income and coding and billing and revenue.
Excellent. And so today I wanted to ask Don about a very common misconception that we find with our patients, but we also find it among a lot of providers. And that's on the topic of Medicare and the difference between Part B and Part C Medicare. So I guess maybe to start with, we should just identify that there are some different parts to Medicare and just what each of those do.
That's a great idea. Well, with Medicare Part A, they cover the hospital facility services like hospitals and skilled nursing facilities. And Medicare Part B is also called the traditional red, white, and blue Medicare that's been around since 1965. And that's the one where you pay premiums for your Medicare Part B coverage that covers the physician services, nurse practitioners, et cetera, the professional services. Medicare Part C came out around 20 years ago or so, if I remember correctly. And that's the Medicare Advantage or alternative Medicare programs that's out there. They're the ones that you see advertised on television all the time, saying, hey, you don't have any premiums. You're going to get a free gym membership. We're going to cover hearing aids if you sign up for this. And they get paid by Medicare Part C. Medicare Part C gets paid by CMS by the number of enrollees they have and the number of diagnoses those enrollees have. And so it's a different type of program of Medicare. The problem is that Medicare patients or providers don't even really know the difference between the two.
Right. And before we get more into Part C, because there's so much that I think people need to understand about that, the last Medicare is Part D, correct?
Yes, ma'am. Medicare Part D. It's like I have Medicare Part D that covers my drugs and the prescriptions that I take. Also, you have the Medicare Medigap plans out there that covers the other 20% after Medicare Part B pays.
Right.
So in my case, for instance, I have Medicare Part B, then I have the Medigap, and then I have Medicare Part D that covers my prescriptions. So after I've hit my $230 deductible every year, Medicare and the Medigap and everything else is covered. I don't have to worry about it.
Right. Which is great for a person who's on Medicare, although some people, that Medigap plan, and I think we need to be aware of that too, that Medigap plan may be a Medicaid plan depending on the person's level of income and what they qualify for. So there's a lot of things. So the Medicare is really what we're all used to. We bill Medicare. If there's a Medigap plan or whoever the secondary is, it gets crosswalked over to whoever that secondary is. And so Medicare gives us 80%, and the Medigap plan will give us the additional 20%.
Yes.
But then Part C. Part C. So I know one of the questions that I get a lot is with Part C plans, I'm signed up with Medicare. I'm already credentialed. How come they're not paying me and this person has, say, a Blue Cross Part C or United or whomever?
Exactly. In order to be able to get paid from that Medicare Part C plan, Advantage plan, whatever you want to call it, you have to be enrolled with them as a provider. So that means, yes, you're already enrolled in Medicare Part B nationally through the PACA system, but you'd have to go enroll with Humana or Blue Cross or United Healthcare Medicare Advantage plan or any of the other hundreds of Medicare Advantage plans that's out there in order for them to be sending you the checks.
And that's true. So you got to go ahead and get credentialed with whoever it is, and it could be like you said, hundreds, literally hundreds of different plans because, and let's face it, I'll say this, being able to offer a Medicare Part C is obviously very lucrative to these insurance companies. So this is something that they want to do. So you're going to have to just get credentialed with all of those. Now, Dawn, does the Part C plan, let's just say it's Humana,
Okay.
do they have to pay the same? Do they have to have the same fee schedule that Medicare has for Part B?
No, they do not. In fact, they have to pay for everything that Medicare Part B pays for. That's what CMS has come out with, since CMS is paying both Part C and Part B. But they don't pay the same rates where a provider would agree to a certain rate. They also don't have the same timely filing period, where with Medicare Part B, you have 1 year. With Humana or United Healthcare or Blue Cross or any of the others, you might only have 120 days or 90 days. It depends on the particular plan.
So if we have a less filing fee, and let's just make sure that people understand that. What is that timely filing? What does that mean?
Timely filing means that from the date that the service is being provided, you have a certain amount of time that beyond that, the claim is worthless. So like with Medicare Part B, you have 1 year from the date of the service to file the claim and get that claim into the Medicare provider system, the MAC system, Medicare Administrative Contractor. Where
Right.
with Humana or United Healthcare or Blue Cross or whoever, you might have only 120 days or 90 days, depending upon the contract that you signed with them.
Mm-hmm, mm-hmm. So that's really important. But that's, so as long as that claim has been made, you're within that. And truly, a claim should be filed as soon as possible after the visit, within a week. Especially if you want to take into account the 7 days before or after type of thing, you got to get that in there.
Exactly.
So let's just say I see a Part C patient, somebody who has, and I'm picking on Humana, not because I have anything against Humana, just they're in my mind for some reason.
Okay.
Usually it's Blue Cross I pick on. I will pick on Blue Cross, but today I'll pick on Humana. So I get that sent off to Humana, and they're going to still pay me whatever, is it 80% of that allowable? There's no Medigap plan behind that?
There is no Medigap plan behind that because patients can't take out a Medigap plan if they have Medicare Part C. Right. What you're getting from the Medicare Part C plan is going to be it, plus the patient's copay. And that copay can vary. Also, it can climb up to be quite a bit of money at times, which is one of the problems that I have with Medicare Part C plans. For instance, they may never tell the patient that, you're going to have to spend more out of pocket. What they'll promise the patient is, well, you won't have anything up premiums. There won't be anything up front. And they never mention the back end that they're having to get billed, they're getting bills for. For instance, I'll give you a good example. My father, when he was alive, was selling Medigap plans. Medicare Part C plans to patients. And I kept telling Dad, I'm not sure you're doing the best thing for your clients when you do this. He said, no, Dad, son, trust me. I know this. I said, okay, Dad, but I really don't think so. And then when he had his major heart attack, he said, Dad, son, you wouldn't believe how much I'm having to pay out of pocket now. And I've got my own plan that I was selling. I'm not mentioning the name of the company, but I've got my own plan. And he said, it's outrageous. You tried to tell me. I said, yes, sir, I did. I said, keep in mind that the same amount of money, CMS is giving the same amount of money to Part B as they're giving to Part C. Part C is the one that you're seeing advertised on TV. I mean, Kelsey Grammer costs money to advertise. Bill Shatner, I think, made $7 million for advertising. J.J. Williams, Joe Namath, I think he had been paid something like $13 million for all the advertising that he does on that. Well, that money's got to come from somewhere, so it comes out of that pot that CMS is paying the Part C plans. Then the Part C plans do not have as much money to be able to spend on the diagnostics or other services. So Medicare Part C plans will make you get a pre-authorization before you can get a service, where Medicare Part B does not have the pre-authorization. And the patient say, well, I want this surgery, and my doctor says I need it, or I need this diagnostic test, I need this MRI. Well, you weren't approved. So that means you have to pay for it out of your pocket. You don't hear Joe Namath and Bill Shatner mentioning that stuff on the advertisements.
No, you don't. And it is so true about the copays. My practice, I had a primary care practice, but I also had a pain specialty practice. And I had a patient I was seeing for chronic pain. She had a Medicare Part C plan. This is when I learned about them in terms of, I didn't even know I was enrolled with it. So maybe they added it on to the Blue Cross or the Humana when I signed the contract, and I didn't read it carefully enough. But anyway, her copay to see me every time she saw me was $50, 50.
Wow.
Every time she saw me. And at the time, I think Medicare's reimbursement for 214 at that time was $68, I believe. So, she had to pay $50 every time she saw me, and she just couldn't afford to see me. So we tried to work with her primary to continue to provide the medication, and then she would just see me periodically. But yeah.
That's upsetting. And then I'll tell you something that upsets me as much or even more. Some Medicare Part B patients, like I'm on Medicare Part B, some patients are being switched over to Medicare Advantage plans without the patient's knowledge or consent. You say, well, how did they do that? Well, it's illegal for them to do that. But sometimes patients will go up, get this advertisement. We're doing a free luncheon in your area. Come join our lunch right here. When you come in, you sign in. Well, this right here just means you get to sign in for your free lunch. They don't read what they're signing, and what they're signing could switch them over to a Part C plan. Other times, they'll get a telephone call from a person on the phone call and say, hey, we were talking about, excuse me. We want to talk to you about this Medicare Advantage plan. Do you have Medicare Part B? Yes, I do. Okay. Is it okay if we talk to you? Well, yes. What they'll then do is take that recording from the yes and say the patient was agreeing to switch over. And that's totally illegal. That's why you never say yes if any telemarketer ever calls you on the phone and asks you, is this Miss Jones? Don't say yes. Say, my name is Miss Jones. Never say the word yes. I know it sounds totally bogus out there. And yeah, what they're doing is bogus in my mind. It's criminal in my mind. Because then the patients will go see their doctor, or they'll go see their nurse practitioner, and then nurse practitioner files the insurance claim, and it comes back saying this patient does not have Medicare Part B, they have Medicare Advantage. And you're not part of the Advantage plan, so you need to get enrolled if you want to. And then trying to get the patient switched back to Part B is a pain.
Mm-hmm. Yeah. There's really, there's no advantage for the provider. There's no advantage for the patient. So the disadvantages for the provider, from what I'm hearing, is one, you have to go and do a lot more credentialing. Two, you may not be reimbursed what you would expect from Medicare. Three, you're going to have to do a lot of prior authorizations, which is the bane of any provider's existence.
Amen.
That just is ridiculous. And then for your patients, they may not be able to continue to see you if they have higher copays because they cannot afford it, like in the case of my particular patient.
Exactly. And I'll toss something else out there to think about that patients aren't being told. And again, I just been on Medicare a couple of years, and I was getting the same advertisements that everyone else was. Everybody calling me, sending me information in the mail about switching over and et cetera. And then what they'll tell you is, look, if you do switch over to us and later you want to go back to Medicare Part B, you can. And you can go back to Medicare Part B later. What they don't tell you is once you go back to, or once you've initially chosen the Medicare Part C plan, you can no longer automatically be accepted by the Medigap plans. So later, if you decide to switch over to Medicare Part B, because you've tried this Medigap plan and you figured out, this Medicare Advantage plan, and you figured out that the Medicare Advantage plan is not what you were hoping, and you want to go back to Medicare Part B, yes, you can go back to Medicare Part B, but what you cannot do is get a Medigap plan, because then they don't have to accept you. If you have any medical conditions, you've had a heart attack, you've had cancer, you've had hypertension, you have diabetes, etc., the Medigap plans do not have to accept you. So that means that you won't get help in paying the other 20%. That's why it's so important from the very beginning. Do not jump into bed with a Medicare Advantage plan until you know all of the details. And I have a little problem with nurse practitioners and physicians that's keeping their mouth silent. They're gagging themselves. They think, I can't tell my patients why it's dangerous for them to switch over to this, or why at 64 years old they shouldn't just jump into a Medicare Advantage plan. And they can. In fact, if you don't say anything, then they're going to believe Bill Shatner and Joe Namath on TV, because they're not hearing otherwise. So I implore every one of your nurse practitioners, I implore every medical provider in the country, please do something that sends out, or let something out, leave out in your office, that patients 64 years old can read and say, wow, this is what you have to look forward to. You have a decision to make. Here's some of the facts that you may not be being told, but you may not be receiving from other people.
Right.
Agreed.
Right. And, another danger here is that some providers, some clinics, like the clinic that I go to, it's, one of these larger clinics. I really want the small mom and pop practice again. But anyway, these larger clinics, a lot of times they advertise Part C plans, Medicare Advantage plans. Sign up for this. I would imagine, I don't know if they're getting a quote unquote kickback or some kind of an affiliate payment, or what the deal is, but we have to be careful about that. And so if somebody does approach you, think twice before you say, oh yeah, I'll put this in our waiting room, or whatever the case may be. Don, is there any kind of a pro and con checklist that maybe providers can get access to? Does Medicare put anything like that out that you're aware of, that shows this is what you get with Part B, this is what you get with Part C?
There may not be yet, but Joe, I think this is something you and I need to. I think we need to create something like that. I like the idea. Yeah, I don't know of anything that CMS puts out comparing Part B to Part C for patients, other than the Medicare.gov website. Medicare.gov website is made for patients, and I'm not sure if they go into full detail about this on their website. I need to look and see.
Okay. Yeah, that might be a good thing, or anybody who's listening to this, create your own little checklist, at least to get you started, so that if your patients are asking you, you have that information. But also, please, as you're considering whether you even want to enroll with Part C plans, you want to take a look at, what does that mean for you in your practice? How much more time are you going to have to spend on prior authorizations? How much less will you get reimbursed? How much, what I call the hassle factor, are you going to be adding to your practice? Because we don't want to add any more hassles to any provider's practice. So
no,
yeah.
you already have enough hurdles to jump over right now. You don't need to add more to it.
Yeah. The hassle factor to me is a huge thing. And I think people need to keep that in mind whenever they're signing up for any particular plan or anything like that. So is there anything else that I haven't asked you about these Advantage plans that providers want to know for themselves and for their patients?
Well, I think we've pretty well covered all the different areas of how the patients are being lied to and constantly inundated with advertisements for it. And just the fact that they're throwing so much money at that should tell you something. That
Right.
they're really, because just follow the money. If they're throwing that much money at it, they got to be getting that money from somewhere.
Yeah.
And from a provider standpoint, I'll tell you something else that it just now dawned on me. A lot of times you'll get a request from a Medicare Advantage plan that you're in already a provider with, you're enrolled with. And they'll sit there and say, we're conducting an audit on these patients right here. Please send us all of the records you have on those patients and from these dates of service. And you're sitting there thinking, oh my goodness, are they auditing my coding? Are they auditing my documentation? Are they auditing the codes that I build? Where it's none of those things. 99% of the time when you're getting those requests from the Medicare Advantage plans, what they want all your records for is so that they can go through the records and identify if this particular patient doesn't just have 4 diagnoses, but there's a couple of others that they may have that you didn't put on the claim form, because they get paid more money from CMS by the number of diagnoses the patients have. So what they're doing is data mining your patient record in order to be able to get the additional diagnoses so that their Medicare Advantage plan can get some more money, for bonus money, out of the Centers for Medicare and Medicaid Services and Health and Human Services. But they don't tell you that. So you start freaking out thinking, oh my gosh, I'm being audited. And it's not really an audit. And then the question is, do you have to give that to them? Well, yes, you have to give it to them, but only if they pay you for your copies and time that you spent creating those. And every state has how much you can bill out to the insurance company. And you send them an invoice saying, upon receipt of this invoice, I'll send you those 7 records you're wanting. And so you don't have to do those for free.
I'm kind of speechless here. I did not know that that's the reason that they do those things. So interesting. So, I just would implore nurse practitioners to think twice about Advantage plans. And certainly, for any provider, we are doing this because we want the best for our patients. So, make your decision as to whether this is a good thing or not, which it's not.
But, and I take it from me, I've been Medicare reimbursement consultant for 38 years. And whenever I got to be an old guy, which one did I go with? I went with Medicare Part B. I got a Medigap and I've got a Part D plan. Now, do I pay for those premiums? Yeah, because I'm still working. I pay more than that $170 a month. I'm paying over $500 a month for those, but it's well worth it to me to do so. Yeah. Rather than me going to a Part C plan and thinking, well, I won't have to pay anything. If I'm doing that, think about why.
Right. Excellent. Well, thank you so much, Don, and thank you for everybody who's watching us, and we'll see you on our next video.